ओम धम धन्वंतरे नमः। यागादिरोगान् सतान शक्तान् अशेषकायान् प्रसतान शेषान् औत्सुक्य मोहान् रजितान् चखान योगूरवैद्याय नमोस्तस्मै। This topic is study on vitiligo. Vitiligo is a disease where there is a depigmentation of the skin in some areas, usually on the bilateral it will be present. So there will be a autoimmune disease which may cause antibodies against antibodies which react against the melanin pigment in the skin and destroy it. Melanocytes are destroyed and there will be depigmentation of the skin. The patient with vitiligo can see bilaterally the depigmentation areas of skin. Vitiligo is a chronic, long-lasting autoimmune disorder that causes patches of skin to lose pigment or color. This happens when melanocytes, skin cells that make pigment, are attacked and destroyed, causing the skin to turn a milky white color. In vitiligo, the white patches are usually appear symmetrically on both sides of your body, such as on both hands or both knees. Sometimes there can be a rapid loss of color or pigment and even cover a large area. Segmental subtype of vitiligo is much less common and happens when the white patches are only on one segment or side of your body, such as a leg, one side of the face, or arm. This type of vitiligo often begins at an early age and progresses for 6 to 12 months and then usually stops. Vitiligo is an autoimmune disease. Normally, the immune system works throughout your body to fight off and defend your body from viruses, bacteria, and infection. In people with autoimmune diseases, the immune cells attack the body's own healthy tissues by mistake. People with vitiligo may be more likely to develop other autoimmune disorders as well. Vitiligo seems to be more common in people who have a family history of the disorder or who have certain autoimmune diseases, including Addison's disease, pernicious anemia, psoriasis, rheumatoid arthritis, systemic lupus erythematosus, thyroid disease, and type 1 diabetes. The main symptom of vitiligo is loss of natural color of pigment called depigmentation. The depigmented patches can appear anywhere in your body and can affect skin, which develops milky white patches, often on the hands, feet, arms, and face. However, the patches can appear anywhere. Hair, which can turn white in areas where the skin is losing pigment. It can happen on the scalp, eyebrow, eyelash, beard, and body hair. Mucous membranes such as the inside of your mouth or nose. People with vitiligo can also develop low self-esteem or a poor self-image from concerns about appearance, which can affect quality of life. Uveitis is a general term that describes inflammation or swelling of the eye, swelling in the eye, inflammation of the ear. Cause of vitiligo. Scientists believe that vitiligo is an autoimmune disease in which the body's immune system attacks and destroys the melanocytes. In addition, researchers continue to study how family history and genes may play a role in causing vitiligo. Sometimes, an event such as a sunburn, emotional distress, or exposure to a chemical can trigger vitiligo or make it worse. The patient of vitiligo, you can see the areas of depigmentation in the hand. The other patient, the skin, you can see areas of depigmentation. The patient within both the hands, there are areas of depigmentation, that is vitiligo. This patient, you can see in the hand the areas of depigmentation. This is an autoimmune disease where the antibodies act against the melanocytes and destroy, causing depigmentation. You see in the face also, bilaterally around the eyes and around the mouth and nose, there are areas of depigmentation. They're also in the neck, back of the neck, you can see on the back, you can see areas of depigmentation. In the hand, this patient, in the hand, so there is areas of depigmentation. So in case of vitiligo. In the cheek, you see, there is a depigmented area. In this patient, in both hands, there are depigmented areas. In the case of vitiligo. Here also in this patient, you can see in the dorsum of the hand, there is areas, depigmented areas. This patient also having depigmented areas. The hairs will be white, but touch sensation will be there, will persistent. Yes, in this patient, around the eyes and below the mouth, there are areas of depigmentation. This patient, the hand, both hands, there are areas of depigmentation. Yes, in this patient, hands and the face, there are areas of depigmentation. This is due to loss of melanocytes in the skin. See, around the lips, there are areas of depigmentation. This patient, you can see around the eyes and forehead, there are areas of depigmentation. Case of vitiligo. This patient also has areas of depigmentation around the eyes. This patient bilaterally, there are areas of depigmentation. Hairs are also white. Case of vitiligo. Unilaterally, there is segmented. There is depigmentation areas of the hand. Case of vitiligo. The genes are responsible for the autoimmune disease vitiligo. This patient, the hand can see areas of depigmentation. Case of vitiligo, you can see in the hands, there are wide areas of depigmentation. In this patient, in both the hands, there are areas of depigmentation. Touch sensation will be normal, but the hairs will be white. This patient also has areas of depigmentation. Your case of vitiligo. See here, that is areas of pigmentation. This patient in the face, there are wide areas of pigmentation, white patches. That is of vitiligo. This patient also has white areas in the skin, the hand. If you keenly observe in the back of the patient, there are areas of pigmentation, but the sensation will be normal, as will be white. In case of vitiligo. In this patient, you can see in the hand, there are areas of depigmentation. Usual case of vitiligo. You can see bilaterally, there are areas of depigmentation. This also patient has areas of depigmentation in the hand. This patient, the hand, there are wide areas of depigmentation, white skin, white hair. In case of vitiligo. This patient also has the patches of white skin. In this patient, the both hands there are areas of white pigmentation. The patient of vitiligo. You can see in this patient bilaterally there are areas of depigmentation in the hands. Case of vitiligo. The leg, knee joints, you can see areas of depigmentation. This patient hands, fingers, there are areas of depigmentation. So around the eyes, there are areas of depigmentation. Case of vitiligo, eyelashes. You can see in this patient hand, there is areas of depigmentation, white skin. Case of vitiligo. The other patient where the chest having white areas of depigmentation. This patient can see in the face there are areas of depigmentation. Case of vitiligo. This patient, the hands, there are areas of white skin. That sensation will be normal, as will be white. This patient also has areas of depigmentation in the hand. In both the hands, there are areas of depigmentation. In this patient, in the back of the patient, there are small areas of depigmentation. Case of vitiligo. You can see in this patient, in the face, there are areas of white skin. So today we have discussed the causes and the clinical features of vitiligo. Thank you for patient hearing.